The two tendons that attach the biceps muscles, the muscles in the front of the upper arms, to the shoulder bones have a degenerative disorder called biceps tendinosis. One of these, the long head biceps tendon, travels from the muscle to the labrum, the cartilage layer that widens and softens the socket to aid with shoulder joint stabilization. Typically, an athletic injury or the natural aging process is what causes the condition, which can be extremely painful. What leads to tendinitis in the biceps? Patients with biceps tendinitis, which happens when the tendon surrounding the biceps muscle is irritated, are more likely to develop biceps tendinosis. Deep shoulder soreness and pains are the typical symptoms of biceps tendinosis, which may get worse when the arm is raised above the head. The severity of the symptoms, the patient's medical history, and the general range of motion in the shoulder are all considered in the diagnosis of biceps tendinosis. For this illness, conservative therapies are frequently beneficial. These may include using cold packs to ease pain and swelling, taking painkillers, getting physical therapy, getting corticosteroid injections, and staying away from occupations that call for overhead motions. An arm biceps tendinitis operation may be required to reduce pain and restore full function if problems continue after 3 months of conservative treatments. Most frequently, this procedure is carried out alongside a more involved shoulder procedure, like a rotator cuff repair. How does biceps tendinitis present? Tendinopathy is a general term used to describe any illness that causes discomfort or damage to a tendon, including bicep tendinitis. People of all ages are susceptible to the somewhat frequent illness known as bicep tendinitis. Middle-aged adults are more likely to experience it, especially those who engage in overhead sports like weightlifting or tennis. Front of the shoulder discomfort that travels down the arm. Arm sluggishness. When touched, the affected area feels tender or sore. Irritation or swelling around the tendon. Making popping or cracking noises when moving the arm. Biceps tendinitis, how is it diagnosed? Your medical history and symptoms will be discussed with your doctor. Additionally, they will perform a physical examination and look for any arm soreness, edema, or weakness. In order to acquire a better understanding of the health of your shoulder, your doctor may also employ imaging tests like an MRI or X-ray. These examinations can assist in eliminating further potential causes of your symptoms, such as a rotator cuff injury. What bicep tendinitis treatment options do I have? Bicep tendinitis therapy aims to lessen discomfort and inflammation while still allowing you to use your arm normally. Taking a break from activities that worsen the disease and resting the shoulder. Using ice to relieve discomfort and swelling in the affected area. Taking over-the-counter analgesics like aspirin or ibuprofen. Slinging the arm or using another support to prevent it from moving. Physical treatment to stretch and build up the shoulder's muscles and tendons. Injections of steroids to lessen inflammation. Surgery to replace the injured bicep tendon or even to heal it. What happens when bicep tendinitis is untreated? Biceps tendinitis can progress and cause substantial pain and disability if it is not treated. The tendon may totally tear or rupture in some circumstances. The tendon may require surgery to be repaired. Treatment options exist for bicep tendinitis. Most of our patients can find relief and eventually have the problem resolved with the right care. How effective is physical therapy for bicep tendinitis? Physical therapy does work well to treat bicep tendinitis. Exercises and stretches used in physical therapy assist in increasing the flexibility and strength of the muscles and tendons surrounding the shoulder. This can lessen discomfort and prevent injuries from happening again. Watch and subscribe on YouTube for today's news and reviews.